need a booster shot of the COVID vaccine. Pfizer says data from their researchers suggest a third dose of the COVID vaccine strongly boosts protection against the Delta variant. But not everyone is on board. Our Shannon Lilly joins us live in the studio with what experts have to say about the idea, all new at 11. Shannon?
Well, Candace, experts tell me that there certainly could be benefits to a booster shot, but as for taking steps forward, the data and approval isn't all there yet. For a grocery store worker,
I'm going to get whatever they tell me is going to make me safe.
And a mom who works closely with the sick.
I still see people who are very sick at the hospital with COVID, and majority are unvaccinated.
The idea of getting a third COVID shot, if needed to boost the immune system, isn't a tough choice.
I mean, I wouldn't think twice about it. I would definitely get it as soon as it was offered.
But not everyone is on board. In a July 12 CBS 6 Facebook post about the possibility of a booster, Brittany Ann says, quote, "I'm double vaccinated and I'm not even sure if I'll get the booster."
I think it's really encouraging news that came out this morning.
On Wednesday, new data released by Pfizer showed a third dose of the vaccine could strongly boost your protection against the Delta variant, with an 11-fold increase in neutralizing antibodies in adults aged 65 to 85.
But what it would really do is continue to combat the issue that we might be starting to see now based on some of this data, which is waning immunity.
Marshall VOGT is an epidemiologist with the Virginia Department of Health. He says while that may be the case, Pfizer's data for a third shot is still preliminary.
Very small numbers in a lot of the trials too, so I think this is encouraging news, but we need to see more data and really learn more about what Pfizer is thinking might be ideal, and then what FDA and CDC have to say.
And the question that remains, he says, is how it would come into approval.
So, for instance, the FDA would need to look at this and either maybe amend the emergency use authorization and existing that exists already for Pfizer, or issue a new emergency use authorization.
While all of that still needs to be sorted out, VCU infectious disease epidemiologist Dr. Richard Wenzel says there are arguments to move forward with a booster.
If you take people who in the country have any kind of hematologic malignancies like leukemia or lymphoma, what we've seen in a few studies is only half of them develop antibodies after the second shot. The other thing we know, if you just look at who's getting the breakthroughs, among the vaccinated people, 45% of them are over age 60. As you age, as you become a senior and beyond, you may not develop the robust immune response that younger people develop.
Now, as for when we could see a booster shot or the third dose available here in Virginia, VOGT says it's tough to put a time frame on it, but he estimates it could take weeks, if not months, to give more time to look at the data.